Hello everyone, this transmission is from Center for Health Education, Awareness Resources and Services International Station. We are connecting you to our Indian station. Please wait.
Connection successful with Indian station. Thank you, operator. Center for Health Education, Awareness Resources and Services, CHEERS, is dedicated to educate the general public on various aspects of health issues. We are providing a platform for healthcare students and professionals to share their knowledge and innovative ideas with general public. In the series of educational activities, title for this webinar is Glimpses on Career Opportunities in Pharmacy Education. This webinar is brought to you by Center for Health Education, Awareness Resources and Services, in association with Indian Pharmaceutical Association, Mangalore Local Branch. Today we have with us Dr. A. R. Shabaraya, President, Indian Pharmaceutical Association, Mangalore Local Branch. Director and Principal, Srinivas College of Pharmacy, Mangalore. Mr. Pushpakara Ganguli, former Registered Pharmacist, CVS Pharmacy, Jacksonville, Florida. And Dr. Ateendra, President, Center for Health Education, Awareness Resources and Services, Station, India. Moving to our substation for first speaker. Dr. Ateendra, President, Center for Health Education, Awareness Resources and Services, Station, India. Dr. Jha is going to deliver webinar on Pharmacist in Current Scenario. Sir, over to you.
Hello everyone, today we are going to see in this webinar that what all are the scope of pharmacy. What all a pharmacist can do. Why there was a need of these type of webinars? First question will come in our mind. Because when we cross 10th standard, we have one aim to reach to the 12th standard. But when we reach to the 12th standard, we really confuse that where to go now. What to do now? Where is the scope? Where I can get a good career? None of the profession is bad. Each and every profession has its own value. Today we are going to discuss mostly on the pharmacy profession because this profession has really got some wrong idea in the society. You might be thinking that pharmacy is just on the store. It is more than that actually. It is not just on the store. It is outside of that also. It is everywhere, wherever you are visiting the healthcare system. Either it is the production level or it is the treatment level. Everywhere it is. So I'm going to cover lightly on the point that where are and why there is a need of pharmacist. On what basis I am saying that there is a need of a pharmacist in the society. Something will happen like this only in your mind, right? After 12th, where to go? There are many ways. We will get confused in our mind that where actually we have to enter, where actually we have to go, which area is good for me. None of the area is bad, that I am clearing now only. But yes, if you are selecting a pharmacy field, really it will become a very good career option for you. Let's see how. On what basis you are going to select any career, or you can say that on what basis you are going to select any stream. First thing you should have in your mind that that stream should have an opportunity. That career option should have opportunity to do something good, right? So if the career has the opportunity to do something good, you will get a broad area to do something. You will get a good option to do something, right? So if opportunities are good, It really will help you to come out. And really, pharmacy field has a lots of opportunity that you will come to know in our for the session in our session, which for the speakers are going to take. So where all we have the opportunities. I'll just give you briefly that we have opportunity from the production of the drug till the treatment of the drug. Everywhere we have the opportunity. So we have a lots of opportunity. We have opportunity, but either this is only sufficient for a career growth, either this is only sufficient for an occupation to adjust in the society, either this is only the sufficient, this is only required. No. One more thing we should have, that is need. Society should need us. So there should be a demand from the society. Like other marketing things, I think this occupation is also working like that. Demand and supply. If demand is there, obviously supply you will be supplied at the good place. So if society is demanding you, if society is demanding you, you will get placed. You will have a bright career. Now the question is how I can see that society is demanding me, right? How I can just say that society is, I should prove that, right? With 1.5 million visits to the pharmacy every week, community pharmacists are the most accessible healthcare profession. Your community pharmacist could provide a range of services like improving health, enhancing accessibility, and promoting the cost effectiveness also. Your pharmacist can help you in your minor ailments where OTC can be given. Your pharmacist can help you in health checkup services. Many community pharmacy have that service nowadays in India, where the health normal BP, BMI, or blood sugars can be checked. New medicine will arrive, then your pharmacist is the best person to tell you about the new medicine, give you information regarding that new medicine. When there's a wide range of vaccinations are available, your pharmacist will be the best person to tell you that which one is good for which problem. Yes, obviously they are not allowed to prescribe in India, but yes, their suggestion will be taken very much seriously. And now healthcare system is taking the pharmacist really seriously. It might be a old era where the pharmacists were not that much in the healthcare team, but now from last 10 years or 15 years, the importance of pharmacy and the pharmacist has increased a lot and has developed a lot. Medicines use reviews also can be taken from the pharmacist, and pharmacists are really what you say that uh, correct source of the information if you want any type of review of any medicine use or medicinal values, because they are directly in contact with the patients and interacting more than any other healthcare professionals are interacting with the patients. So their interaction is much more than the other healthcare professionals. If we see that when we should think about a pharmacy, when we think about the pharmacist, when we have any drug and we want to know about the drugs, where I will get that drug, what is actually about the drug, what actually that drug does, is there any problem with that drug? Pharmacists are the best person for that. Pharmacist will provide you vaccinations easily, can help you to get the vaccinations. Then many chronic problems like diabetes and hypertension, pharmacists can act in very nicely, a very important factor because their counseling on the chronic problems become a very important tool to manage efficiently those problems. So chronic problems can be managed efficiently if the pharmacist you consult a pharmacist and ask that what all things I have to take care. They are the what you say correct person, or you can see that the uh, absolutely right person to give you the advice. Pharmacist will also help you in such type of avoiding in such type of bad habits. And yes, many pharmacists can prescribe you certain minor ailment conditions, and those will be mostly the OTC drug in India. Now, next is that is the Indian. If you read the Indian scenario on the side, in it's data of Canada. 93% of the Canadians have positive impression of the pharmacist, while 93% believe pharmacists play an essential role or important role in the healthcare system. 84% believe that allowing pharmacists to do more for the patients will improve the health outcomes, while 85% have positive idea that pharmacists will reduce their cost of drug or cost of treatment. So you can see that what is the need of pharmacists in the society. In India, when there is a lot or a large group of people at low income, cost effectiveness or cost effective treatment is very needed. What you say, uh, what is demandful that sector in the healthcare system. So managing the cost of the drug or reducing the cost of the drug has become a crucial point in Indian scenario where there is a lot of population below poverty line, or you can say that middle class or lower middle class, right? Did you know that 96% are in favor of the pharmacist providing a minor element scheme, while 98% of the public trust the advice and the patient care they receive from the pharmacist, while 92% are in favor of pharmacists providing services to improve the patient's adherence to medicine. Adherence is really an important point for treatment, and pharmacist can be a really an important factor for that. Now, I have told so much things. Why? Why they will go to the pharmacy? Because doctors are there already and they will consult the doctor. Why to consult the pharmacist for all these things? Do you know that we have one doctor over 1,700 patients? Now you can imagine that how a doctor will handle everything. That's why WHO has clearly told that we should move on task shifting. Tasks should be divided among each and every healthcare professionals, and that's really a needed point nowadays. So you can see the ratio, and after seeing the ratio you can clearly understand that why there's a need of a pharmacist in the healthcare system, and why this pharmacist that role is has become important in healthcare system. It's not only that need, already WHO has told clearly that in six sectors the pharmacy should enter. First is the hospital sector or clinical sector. Second one is while having the discussion on any disease, we should have a pharmacist with us. Third is when we are doing any technical work where there is a healthcare team is required, there should be a pharmacist in that healthcare team. When we are thinking of vaccines or drugs or designing of drugs or thinking of new let's say that component of the drug, we should have a pharmacist. When we are doing the pharmacoeconomical analysis, that is cost effectiveness, then we should have a pharmacist in our team. And at last, when we are working on the any informations or drug informations or disease information, we should have a pharmacist in our team. So WHO has already told that these sectors should have the pharmacist in their team. So this you can see that really there is nowadays the role of pharmacist has become crucial in the healthcare team and is on now demand. So in further session we will see that how the pharmacists have the good career option in India as well as in abroad.
Moving to our substation for second speaker. Dr. A.R. Shabaraya, President, Indian Pharmaceutical Association, Mangalore Local Branch. Director and Principal, Srinivas College of Pharmacy, Mangalore. Dr. Shabaraya is going to deliver webinar on Scope of Pharmacy Education in India, Glimpses. Sir, over to you.
Hi friends, I welcome you all to this session, Scope of Pharmacy Education in India, Glimpses. Many of my student friends, they used to ask me whenever I say about the pharmacy course, what is the scope of pharmacy? What are the job opportunities in India and abroad? Then, for the benefit of those students, I suggest here who is a pharmacist. He is a polite, honest, alert, researcher, motivator, administrator, counselor, innovative, skilled and thinker. Who is a pharmacist? What are his responsibilities? How he will work? A student who completed his PU science discipline, who has taken admission to D Pharm or B Pharm or Pharm D. This D Pharm 2 years diploma in pharmacy, B Pharm 4 years, that is 8 semesters, Bachelor of Pharmacy degree, and Pharm D, Doctor of Pharmacy, 6 years. We'll see what are their responsibilities and how these pharmacists can work. First and foremost area, research and development. You must have realized the importance of hydroxychloroquine. Designed and developed by pharmaceutical industries in India and today could successfully treat COVID-19 patients in Western world. This is the effort of pharmaceutical industry, the research and development. Like that, new products are coming to the market to overcome the problems. Second area is industry, pharmaceutical industries like Cipla, Arvindo, Cadila, many Himalaya. There are so many industries in industry sector: production, regulatory affairs, analysis, and marketing. Other than that, they get into government affairs like government analyst or drug inspector. In pharma marketing, whenever a new product is launched, create demand for new product and continue the demand for the existing product. Ensure the availability at retailers and stockists, sales achievement, customer support, customer service, product promotion, launching new products, developing the markets, market feedback collection, developing the company image. Then, with the D Pharm or with B Pharm, if you are interested to start a community pharmacy, then to go for dispensing, counseling the public on the treatment, manage, supervise, and train staff members, ADR and drug information. Then hospital pharmacist, you have to find out the patient safety, prescription error, ward rounds, patient problems and understanding, and dispensing and administration problems, discuss the treatment alternatives with the medical team, appropriate storage condition has to be taught, supervise the staff, answer the questions related to drugs, active participation in the research and development, frame guidelines for drug use in a hospital and implement inventory, set up and supervise clinical trials. As a clinical pharmacist, another opening, when the new products come to the market, it will be studied. Then you have to go for ward rounds, drug information services, adverse drug reaction monitoring, therapeutic drug monitoring, patient counseling, medical history form, maintenance, and research. As a clinical pharmacist, as academic, you can go for higher education and go for personal development, professional, public, that contribution to the public. After 10 plus 2 or PUC science discipline, you can opt any of this course. That is B Pharm, 2 years diploma course, 4 years degree course or 8 semesters, and 6 years Doctor of Pharmacy program. That is Pharm D. In brief, I would like to recall once again what is the role of pharmacist. That is, he prescription related, he can go for the prescription audit, he has to guide storage and distribution of drugs, he has to advise the doctors for the right choice, drug choice, and he has to go for drug monitoring. Then he has to provide information to the doctors as well as for the patient and educate the patient. He has to involve research and development and many other health activities. He is always in the center of healthcare team. A doctor can give life to a patient, whereas pharmacists can give life to medicines, and it is a noble profession. Proud to be a pharmacist and reduce 5 Ds: disease, disability, dysfunction, dissatisfaction, death rate, and develop a healthy India. And I take this opportunity to thank the organizers giving a chance to represent Indian Pharmaceutical Association, Mangalore local branch, and Srinivas College of Pharmacy, Valachil, Mangalore. Thank you.
Moving to our substation for third speaker, Mr. Pushpakara Ganguli, former registered pharmacist, CVS Pharmacy, Jacksonville, Florida. Mr. Ganguli is going to deliver webinar on pharmacy career opportunities in abroad.
Thank you. Pharmacy career opportunities abroad. I know you are all excited to know about the pharmacy as a profession. I know you have questions in your mind, like what is the pharmacy field about, like what the pharmacist is going to do, what is his job nature. In today's presentation, I'm going to cover points in brief, like growth in pharmaceutical industry and healthcare sector, future progress in pharmaceutical industry, types of pharmacy jobs, nature of job, about like community, hospital and clinical pharmacist as a profession, types of courses in pharmacy education, pharmacy jobs abroad, how to get pharmacy jobs abroad, and reasons why pharmacist job is the best. Growth is required for every industry, and even you want to know what is the growth of the field that you are going to be as a professional. So, in case of the pharmaceutical market, it is expected to overcome $1,500 trillion by 2023, and we reached up to $1,200 trillion for the year 2018, and that's an annual growth of 6%. So, annual growth of like 4 to 10% is a good growth for any industry. So we are doing good there. Global healthcare market is expected to overcome $11,900 billion by year 2022, and the healthcare market reached up to $8,450 billion in 2018, and that's an annual growth of 8.9%. It's a very good growth for the industry. So here we can say the pharmaceutical industry or the healthcare industry is doing pretty good. Going forward, we need to know like how is it going to do in future, and what are the points we can consider that it's going to do good. So between 2015 and 2050, the proportion of world's population over 60 years will nearly double from 12% to 22%. That means the people those are going to get aged is going to increase year by year, and for that, I mean, as a person gets older, the ailments, the person can catch into many diseases or the abnormal conditions. Even the lifestyle disease such are increasing, like obesity. Because of obesity, heart disease and diabetes cases are going to increase year by year. So for that we need more medications, right? So pharmacists, they need more pharmacists to prepare those medications. Even with in the current scenario after this COVID-19, the global healthcare spending is going to go up. They're going to spend more and more for the healthcare needs. So you need more pharmacists in coming days. So let's see what are the types of jobs in this pharmacy field. Community pharmacies, as you have seen, the medical shops outside in your community, right? So those are drugstores, what you call, or pharmacy, what you call. So community pharmacist is the pharmacist who is going to work there. So such a similar setup will be there inside the hospital, and the pharmacist who is going to work inside in the drugstore inside the hospital is nothing but is a hospital pharmacist. And there is also one more pharmacist going to work in bigger hospitals. He is called as clinical pharmacist. And in industries, the drugs whatever are manufactured using raw materials, so those are manufactured by production pharmacists in the industry. These, to control quality of these, there will be a quality control department inside industry, and in quality control department, pharmacist is going to work and he is going to check the quality of the medication. So similarly, quality assurance, there will be quality assurance department, and pharmacist is going to work in the quality assurance department to make sure the drugs are coming out with good quality. And related companies, there are companies which work on pharmacovigilance. Pharmacovigilance is about the safety about the drug, like studying the side effects And there are companies which work on medical billing and coding, billing the patient expenses to the insurance companies. Then there are companies which work on sales and marketing. Whatever the drugs produced in the industry are to be, they go to sell those medications, and there are separate, there are very separate companies which work on these, and they also work on the marketing of these products. So these are the pharmacists, like drug inspectors, and there are pharmacists who work on analyzing the medications, like analysts. The pharmacists also work in academics, like as a lecturer or professors. Pharmacists also work in different associations, taking different jobs. So those are the types of the jobs in pharmacy field. And coming to the major jobs, that jobs which are in abroad places. These are the major jobs in abroad places. Community pharmacies. In community pharmacies, so pharmacists will be working as a community pharmacist, and in hospital pharmacies, the pharmacist can work as hospital pharmacist, and in hospital, in that setting itself, there will be one more type of job, that is clinical pharmacist. Community or hospital pharmacist roles. So what is the role of a pharmacist? What is he going to do? Pharmacists are medication experts. Pharmacist knows both about the manufacturing of the medication. He also knows about the dispensing of the medication. He knows the packing, storage of the medications. He knows how to take the medications, and or how to he can advise the patient on how to take the medication. So he is the expert on medication. Pharmacists provide crucial role in providing quality care, right medication, right patient in bigger settings, like in foreign pharmacies. Prescriptions does not only come through just the patient giving or handing over the prescriptions to the pharmacist to fill the medication. Filling the medication is nothing but preparing the medication for the patient. Or it is also called like dispensing, giving out the medication to the patient. So this is a little complicated situation in foreign pharmacies. That is because the prescriptions come through different directions. So it can come over the phone, like the doctor or nurses can call over the phone, call the pharmacist and tell him to dispense so and so medication. It can come through email, it can come through fax, they can leave the message over the phone. So when before the patient can come to the pharmacist to get his medication, the medication needs to be ready. So in this case, the pharmacist has to make sure that right patient will get the right medication. So pharmacists, they closely work with physicians and nurses and other healthcare professionals. If there are any discrepancies, any problem with the medication, the pharmacist has to call the doctors or nurses and discuss with them to see the medication is okay to give to the patient. If there are any changes needed, the pharmacist discuss with the doctor, and they're going to change the medication. So pharmacist plays a good role in case of maintaining chronic diseases or like asthma. So in asthma patient, pharmacist can guide the patient how to take the asthma medications. Like there are metered dose inhalers. In case of diabetes and high blood pressure, the pharmacist can guide the patient how to check the blood pressure and how to check the blood sugar level using the instruments. In foreign pharmacies, pharmacist is part of immunization program. I myself immunize the patient like I used to immunize at least three types of vaccines to the patient. It's like general annual vaccination program that they go through, like vaccines like influenza, chicken pox or pneumonia will be given to the patient during the winter season. Pharmacists can access minor illness like rashes, constipation, cold sores. A patient come to the pharmacist and ask what is the best medication to be taken for certain minor illnesses, and the pharmacist will, counsel them and find out what is the best medication, over-the-counter medication that he can give to them. Pharmacist assist in smoking cessation. If the person or the patient wants to quit smoking, pharmacist can assist them in a smoking cessation. So then clinical pharmacist, it's a pharmacist job in the hospitals. Clinical pharmacist practice in healthcare setting on patient medication, right? They are focused on patient medication. They collaborate with the healthcare professionals like physician and nurses, and see that if there are any drug interactions between patient medication, what is prescribed, and what the patient is already taking, that way the pharmacist can help the patient. Pharmacist as a profession. So how is it like as a profession? Pharmacist helps improve quality of life for patient. Pharmacists are most successful healthcare providers. Pharmacist job is also a well-paid job, like in abroad, like in United. A pharmacist can earn up to 100,000 to 125,000 per annum. That's in like in United States. Like in Canada and Switzerland, they can earn like 85,000 per annum. Like in UK, Germany, they can earn like 60,000 per annum. So after COVID-19, there is an increasing need for healthcare providers all over the world. So you can imagine the extent or the proportion of demand for the pharmacist job abroad after COVID-19. And how to get pharmacist job abroad? So before that, I would like to mention these pharmacy education in India. So what are the types of courses that are available in India to become a pharmacist? So diploma in pharmacy, DPharm, so it's a 2-year course. BPharm or Bachelor of Pharmacy, it's a 4-year course with 8 semesters. Master of Pharmacy, MPharm, it's a 2-year course. Pharm D, a Doctor of Pharmacy, it's a 5 plus 1 year course. 1 year is for internship. Then the PhD, anybody interested in doing the research, they can go for research. So that is a Doctor of Philosophy. And major steps for United States, if you want to become pharmacist in United States, these are the steps you have to follow. Apply and take foreign pharmacy graduate equivalency exam, FPGE, and take test of English as a foreign language, TOEFL, or there is a TOEFL IBT internet based test. So in this test, they are going to check your written English and reading ability, then spoken English and listening skill. So in case of FPGE, so they're going to test your degree that is in a foreign country or India, like they are going to review you on the whole course. Then the person has to take North American Pharmacist Licensure Examination, that is NAPLEX. Then after NAPLEX, the person has to take pharmacy law test, that is multi-state pharmacy jurisprudence exam, MPJE. And these both exams, NAPLEX and MPJE, even the American pharmacy students, they are going to give these tests to become a pharmacist. And the person has to complete internship hours between 500 to 1500 hours, 500 to 1500 hours. It depends on the hours, depends on the pharmacist trying to go for the like different states. Like in United States there are different states. If different states will have different hours for internship. So these are the exams you are supposed to go through. Actually, as soon as you pass the FPG, you can go for internship, and the remaining exams you can get them done, while doing the internship. One other thing is, out of these courses, in India, only Form D is eligible for job in United States. That is because in 2003, January 2003, they passed a regulation that after 2003, whoever passes the foreign degree within four years, or within 4 years, they are not eligible to become a pharmacist in the United States. So if you are a pharmacist who passed out the exam before 2003, you can work in United States as a pharmacist. But after 2003, you have to do a 5-year course of pharmacy. And in India we have Form D, as it has got 1 plus 5 year. It is a 1 plus 5 year course. So if you are done that, if you are you can go for pharmacist as in United States. Then major steps for other countries like United States, you have to pass these exams, like one evaluating exam. In evaluating exam, they test you as your pharmacy knowledge, like they test your course in the foreign country. Then you have to write a qualifying exam like the NAPLEX. The first one is like FPG, the second one is like NAPLEX. You have to pass English language fluency exams like the TOEFL. Then you have to pass the pharmacy law exam like the MPJE. Then you have to do the training or internship, or whatever the stipulated hour they fix you for. Then these are the reasons why pharmacist job is the best. It's a diverse career option. Like as we have seen before, there are many types of jobs in the pharmacy profession. Flexibility of work-life balance. It's not like that you sit on the computer for hours together and you can work. They make you work longer. It's not like that. It's like 8 hours shift, and you can have a good work-life balance. Job growth potential. There is a lot of job growth potential in this field. Salary-wise, it's a well-paid job. There is availability of online resources, means newses, research articles, any information, they are all available online easily. Then there will be close-knit community. A lot of pharmacists are there in the field. Availability of mentors. A lot of senior staffs or seniors are there in this field, so you can have them as a mentor. So it's a respected profession. There is autonomy on the job. You can take a decision of your own. There is ability to help the people in this profession. So with all these reasons, pharmacist is the best job to work. So it's a best career choice. So I have gone through these references like Pharmacy Times. It's a good magazine. I used to read this when I was in United States. Then I have gone through these websites, businesswire.com, pharmawordmagazine.com, and I used slides from this website, powertemplate.com. Thank you very much.
Thank you Dr. A.R. Shabaraya, Mr. Pushpakara Ganguli and Dr. Ateendra. Thank you all for your valuable time. Please move for certification at our event page. You can find event page link in description. Closing the session. Operator. Disconnecting Indian as well as international station.